Have you ever seen a child who seems to develop more slowly than others? Maybe they're not talking, walking, or smiling at the same time as kids their age. Or perhaps you've noticed a baby with a very tiny head or who doesn't gain weight well. These could be signs of something rare but serious. One such condition is Wolf-Hirschhorn Syndrome, also called 4p deletion. It's caused when a baby is born missing a small piece of chromosome 4. While it's rare, it affects how the body and brain grow. Think of chromosomes like instruction manuals for building a human. If a page is missing, the body might not get the right directions. That's why children with WHS face many challenges from birth. So what causes this missing piece of the instruction manual? It's called a genetic deletion. Most of the time it happens by pure chance when the egg or sperm forms no one did anything wrong. Picture it like a typo when copying a recipe. One small but important ingredient is left out. In about 85% of cases, WHS isn't inherited. It's like a random accident during cell division. But in some cases, one parent may carry a balanced translocation, meaning their chromosomes are swapped, but still work fine for them. However, they can pass an unbalanced set to their child, which leads to missing parts. Think of it like shuffling two decks of cards. Perfectly, if one card gets dropped, the next player gets an incomplete hand. Imagine a baby who has a unique facial look, like wide-set eyes, a flat nose, and a small chin, sometimes described as a Greek warrior helmet face. They may cry weakly, eat poorly, and grow very slowly. Many children with WHS have seizures, like sudden shaking or staring spells, similar to epilepsy. They often miss developmental milestones. Maybe they can't sit up by 1 year or say simple words like mama. Some also have heart problems or hearing and vision issues. For example, a parent might worry because their 18-month-old still can't walk or respond to their name. These are red flags that lead doctors to dig deeper. First, they look at the signs, the facial features and delays. But to be sure, they do a special test called a chromosomal microarray or FISH test. It's like zooming in on the DNA to spot the missing piece on chromosome 4. Think of it like using a detective's magnifying glass to find a torn page in a book. Once confirmed, treatment isn't a cure, but it helps manage symptoms. For example, if a child has seizures, they get medicine to control them. If they can't eat well, a feeding tube might help. Physical therapy, speech therapy, and special education are key to helping these kids grow stronger and learn. A team of doctors, therapists, and parents work together, like a village raising a child with extra love and support. Can we prevent WHS? Well, since most cases are random, you can't stop it like a cold. But if a family already has a child with WHS, they can talk to a genetic counselor before having another baby. It's like getting a roadmap before a trip. The counselor might test the parent's blood to see if one carries a hidden chromosome swap. If so, they can discuss options like IVF with genetic testing to pick embryos without the deletion. But for most families with no history, prevention isn't possible. The focus is on early detection and support. It's not about blame. It's about helping families prepare and get the right help early. Scientists aren't giving up. Recent research is trying to understand which exact genes are missing in chromosome 4 and how each one affects the body. For example, losing a gene called WHSC1 might be linked to facial features and growth delays. Some studies use zebrafish or mice with similar deletions to test treatments. There's also hope in gene therapy, not yet ready but being explored. New technologies like CRISPR might one day correct such errors, but that's still far off. For now, advances mean earlier diagnosis, better symptom care, and more support for families. Imagine a future where a simple blood test at birth catches such conditions early. That's where